Okay, guys, Timmy coming at you. Today, I'm going to talk to you about anaphylactic shock. First of all, in order to understand anaphylactic shock, you got to understand a little bit about the immune system. So that's what I'm going to try and do for you today. First of all, a couple of terms. Number one, antigen. Antigen is anything that produces an immune response. So that could be anything, right? From, like it says, bacteria to a sliver. You get a sliver in your finger, that gets red, swollen. And pathogen is an antigen that can produce disease. So bacteria, viruses, fungi, protozoa. The one we want to talk about today is an allergen. And this is one time where the body does stuff that doesn't make sense. It reacts or overreacts to something that it shouldn't overreact to. And that's essentially an allergy. So this is one time the immune response is inappropriate, that overreaction. And the primary function of the immune system is to produce inflammation. And very quickly, and again, you know, if you get this, you understand these little key things, it makes so much sense. So, inflammation. Occurs for basically two reasons, or the mechanics of inflammation. There is massive arterial vasodilation. So watch. You get a boil on your butt. Where are the cells of the immune system? They're in the blood. How does those cells of the immune system get to where they need to go? In the blood. So if an artery supplying your butt is this big and then it dilates, more warm arterial blood is going to go through that bigger artery. That's why an infected area gets red and warm. It gets red and warm because the immune system is causing the arteries in that infected area to dilate, so more warm arterial blood is going there. Number two, the capillaries that supply that area, they get leaky. So what happens is that blood plasma, the plasma of the blood, starts leaking out into the tissues. That's why the area gets swollen. So what are the signs of inflammation? It's warm, it's red, it is swollen. And it is the result of the immune system causing these two things. The things that cause it, several chemicals cause it, but a big chemical is called histamine. And histamines are released from these cells that you have all over your body called mast cells. Mast cells contain histamine. And when histamines are released, at least locally, they cause the arteries to dilate and the capillaries to become leaky. So if you look at a picture, just real quick, of my two curved lines in a circle, here you are. Here's your little capillary. And then here's your cell, right? Who cares what cell it is? Then you got a little interstitial space here, right? That's normal. What happens? Watch. Get a cut. Ouch. Right? So you get a cut, and that's going to cause the arteries that supply that area to dilate so they get bigger, and the capillaries become leaky. So now let's say, for example, you got some bacteria in there. We'll say B for bacteria. That's nice, huh? Word. Then you got a cell. So that bacteria is in the interstitial space. Where do you need the white blood cells to go? You need to go get the white blood cells out there to get them. Where are the white blood cells? Well, the name implies white blood cell. They're in the blood. Write that down. So what's going to happen is Fluid from the plasma is going to flow into the interstitial space. What that does is that allows the white blood cells that were normally flowing in the center here, these white blood cells to come closer to the edge of the capillary. And when white blood cells do that, they can kind of cling on, and then they can actually move out into the area. By that, they can actually squeeze through those little holes and grab that white blood, or grab that bacteria and kill it. So inflammation is a good thing. Too much inflammation is a bad thing. So in an allergic reaction, you get, or an anaphylactic reaction, you get this massive arterial vasodilation everywhere. So first of all, let me just go over a few things about the immune system and just to kind of catch up. All right, so watch. The cells of the immune system are basically, they're born in the bone marrow. So you got white blood cells. You also have these little security areas called lymph nodes. And all lymph fluid, before it can go back to the heart, has to go through a lymph node. So it's like the security at the airport. Everybody, before they get on a plane, has to go through security or they can't get on a plane. So all lymph fluid has to be filtered through a lymph node before it's dumped into the central circulation. So where are lymph nodes in the body? Well, lymph nodes are surrounding the central circulation, surrounding the heart, right? You don't want to get any bacteria into your heart. That's bad for you. And lymph nodes are located at openings to the body, right? That's how bad stuff gets in. Like 70% of your lymphatic system is in your GI tract because that's the biggest opening you have. Then you got lymph nodes around your private parts, mouth. You know what I'm talking about. Here's the important thing. Lymph nodes produce terminators. Lymph nodes produce specific cells of the immune system called B cells and T cells. So these guys are like the terminators of the body. They have to get programmed in order for them to fight off a bad guy. But they only fight off one particular thing, one particular antigen or pathogen. So if you look, watch. For those of you in clinical, you know about the CBC with the differential, right? All red blood cells are pretty much the same. All white blood cells are different. So these guys here are the sons of anarchy, right? They'll kill anything. So they circulate around your blood and lymphatic system, and they look for stuff that ain't them and kills them. These are the lymphocytes, T cells and B cells. I ain't got time to talk about NK cells. But these lymphocytes are specific. And they're programmed. So they're the Arnold Schwarzenegger. They're the terminators. They are only programmed to kill one thing, Sarah Connor, right? So a B cell that's programmed to kill one thing, even if there is another antigen or pathogen floating by, that B cell, if it's not programmed to kill it, it's going to ignore it. So real quick, I'm going to show you how this specific immunity works because it all ties into anaphylaxis. All right? So, watch. You got millions and millions of different B cells and T cells floating around in your blood and lymph. And each one is specific for a specific antigen or pathogen. So embedded in the B cells cell membrane are little receptors, and they will only bind with a specific antigen, something that ain't you, something that's going to produce an immune response. So here you got a bunch of B cells. Well, not a bunch, you got 3. But I didn't have time to write like a million. Otherwise, probably would have never got this video done. But be that as it may. So if you look, you got your little antigen here. Who cares what it is right now, right? Boom. That ain't you. So you got all these B cells floating around. This guy's going to just drive on by. This guy's going to drive on by. But this guy, based on these receptors, it's going to match up. And when a B cell matches up with a specific antigen, that B cell gets turned on. It binds, that receptor binds to that antigen, and then that B cell gets turned on. And that B cell, when it binds with that specific antigen, gets turned on and then divides. And it divides into two very important types of B cells, plasma B cells and memory B cells. So now this B cell is turned on, and it is now only going to attack and destroy this thing right here, whatever it is. It's Sarah Connor. All right. Then, this is the important piece. B cells don't kill directly. What B cells do, these plasma B cells, once they got turned on, now they're going to kill Sarah Connor, right? They're programmed. When they're programmed, they start to produce these proteins called antibodies. And it is the antibodies that circulate in the blood and lymph and will bind to that antigen or pathogen, whatever it is. So here, look, there, that's the antigen. And now you got these antibodies, these proteins that bind to it. And these antibodies that bind to it, these are antibodies, they mark this antigen or pathogen, who cares, for death. Then a monocyte comes in and gobbles it up. So that's how your immune system, at least with respect to B cells, works normally. Now, when you're talking about an allergic reaction, or specifically anaphylaxis, remember, what's the function of the immune system? The function of the immune system is to produce inflammation. Inflammation protects you. Now, immune means protection. Phylaxis means protection. If you are prophylaxis, you are for protection. If you are anaphylaxis, you are without protection. Or, in other words, a total body allergic reaction. So this differs from hay fever or, a rash. This is a total body allergic reaction. And how you get a total body allergic reaction is the thing that you're allergic to has to be injected, ingested, or inhaled. And if you inject, ingest, or inhale an allergen, something you're allergic to, who cares what it is, beef, peanuts, shellfish, whatever. If you get this and you inject it, ingest it, or inhale it, it gets all over your body. It will circulate all over your body. So where do you have the antigen? All over your body. Now, this is important. On your first exposure to an antigen, when you're first exposed to something and the B cell gets turned on, you get these plasma cells, but they don't produce a lot of antibodies. So you hardly even notice it. However, on your second exposure, what do you have lying in wait? You got these memory cells. So I'm making this up, but just to give you an idea. When you're first exposed to something, First time you're exposed to it. The plasma B cells make 1,000 antibodies. But it may take weeks for that to happen. On your second exposure, because you have memory cells, these memory cells remember what you were exposed to. So instead of making 1,000 antibodies in weeks, you make 10 million antibodies. I'm exaggerating, but just for a point. In hours. So what's happening here is that on your second exposure, you get this really huge immune response and this huge rapid production of antibodies. And that's a good thing because your immune system has learned. But in anaphylaxis, that's not necessarily a good thing. And here's why. The normal exposure to something, this happens. Boom. In an allergic reaction, or in this case, anaphylaxis, the same thing happens. The first time you're exposed to something, you're only going to produce a small amount of antibodies. But this is the kicker. This is the huge point. In people who have allergies, or in this case, anaphylaxis, when those antibodies produced by those plasma cells, they don't float freely in the plasma. They bind themselves to a cell called a mast cell. And mast cells contain, we talked about this, a chemical called histamine. What do histamines do? They cause massive arterial vasodilation, and they cause increased capillary leakiness. So the capillaries start leaking fluid. So the difference in someone who has an allergy and someone who doesn't have an allergy is when someone who doesn't have an allergy, the plasma cells produce the antibodies, and the antibodies circulate in the blood, and they bind the antigen or pathogen, and then it's marked for death. In people with allergies, when the plasma cells produce the antibodies, they bind themselves to mast cells. So in this case, if you had, let's say, a bee, right, here comes a bee. There's his wings, and there's a stinger, and then there's your leg. Yup. And the bee comes. God, that's awful. Them Duke boys got my money. Then the bee comes and stings you. I left its stinger, so I'll bring that back. Bam! And that bee injects you with venom. Where's that venom going to be? It's going to circulate all over. This is the second time you got stung by a bee. The first time you got stung by a bee, remember that the immune response was very weak, that you didn't make a lot of antibodies. So because you didn't make a lot of antibodies, you're not going to get that huge exaggerated immune response. But in this case, what do you have? You have bee venom. That is going to stimulate memory cells. They remember. And what are the memory cells going to do? The memory cells are going to divide, produce gazillions and gazillions of plasma cells. And those plasma cells are going to produce gazillions and gazillions of antibodies. So here's the antibodies. Now, remember that in people with allergies, those antibodies attach themselves to mast cells. What do mast cells contain? Histamine. Where's the bee venom? All over. What's the job of the antibodies? The job of the antibody is to attack the antigen, right? So here's bee venom. We'll make bee venom, I don't know, make it blue. Here's the kicker. When the antibodies for the bee venom bind to the antigen, the bee venom, it will, and remember the antibodies now in people who have allergies are bound to mast cells. What do mast cells contain? Histamine. Where's the bee venom? All over your body. When the antibodies bind to the bee venom, the antigen, it causes the mast cell to release histamine. Where's the histamine released? All over your body. What do histamines do to all of your arteries? It causes all of the arteries that were like this to become like this. Where? All over. And if you remember our little discussion of Ohm's flow law, the goal of the cardiovascular system is to maintain blood flow, and blood flow is determined by your systolic blood pressure divided by your resistance to arterial blood flow. The histamines cause the massive arterial vasodilation, so the arteries are huge. Where? All over. So that is going to cause resistance to arterial blood flow to drop, and your systolic blood pressure is going to drop to try to maintain Q. And if you don't have a mean arterial blood pressure of at least 60 millimeters of mercury, you are in shock. What caused the shock? A total body allergic reaction. What's the definition of a total body allergic reaction? Anaphylaxis. And if you can't maintain a mean arterial blood pressure of 60, you are in anaphylactic shock. And that is bad for you. So that's bad for you. Now watch. Is the lining of the respiratory tract and of the oral airway, nasal airway, is it vascular? Please say yes. That's good. So where do the arteries dilate? Everywhere, including the arteries of your airway. So if the arteries dilate, more blood flow is going to go to the mucous membranes of your throat and of your bronchioles. And if you add more blood to them, the bronchial diameter and your airway gets smaller. So watch. Here is your airway. Here's the vascular lining, right? If you have anaphylactic reaction, then it's going to cause all of the arteries to dilate. So more blood flow is going to go there. So that's going to cause your airway to become smaller. So people say, it felt like my airway was closing off. That's because it is. Your tongue will swell, very vascular. Your tongue will swell, that can close off your airway. Your blood pressure will drop. You will start to wheeze because the airways become smaller and constricted. And you will begin to lose consciousness as you go into shock. So they will have, if they're going into shock, they will have shortness of breath, wheezing due to the bronchoconstriction and the swelling of the airway. They will be incredibly anxious because it feels like their airways closing off. They're going to be dizzy, lightheaded. And that is all from the lack of blood flow due to the arterial vasodilation, and can't maintain the blood flow to the brain and vital organs. And then they will become unconscious. They will lose consciousness. Now, they also may present with a rash too and a little swelling. Why will they get swelling? Because what does histamine do to capillaries? It makes those buggers leaky. And when those capillaries become leaky, the fluid from the blood is going to go out into the interstitial space, and that's going to cause swelling. So what do you do? What do you do? Well, remember, A, B, C, D, airway, breathing, circulation, deformity. That's the time you go to the emergency room. So in this case, this is what you do. You got to somehow constrict all of those arteries in your body. Because if you don't, you're going to die. And the only thing that you know that constricts all your arteries is our buddy, our pal, epinephrine. And epinephrine binds to beta 1, and beta 2, and beta 3. And in the periphery, in the peripheral arteries, you have alpha 1 receptors. So when epinephrine binds to beta 1 in the heart, it's going to increase heart rate and increase the force of contraction. So that's a simple way of saying you're going to increase the chronotropic and inotropic effect of the heart. If their blood pressure is low, you want that heart rate higher, and you want that force of contraction so it pumps out more blood. And when epinephrine stimulates alpha 1, it causes all of the arteries that were really, really big to get really, really small. So you will get massive arterial vasoconstriction. Where? Everywhere. And if the resistance to blood flow goes up because your arteries got smaller, right? You gave them epinephrine, so all the arteries got smaller. According to our buddy, our pal, Ohm's flow law, Q equals systolic blood pressure over resistance. R is the resistance to arterial blood flow. If the arteries get smaller, resistance goes up. Therefore, systolic blood pressure has to go up to maintain Q. That's good. What's going to happen to all the blood vessels in the oral airway and in the bronchioles? They're going to constrict. So what's going to happen to the size of the airway? It's going to get bigger, so they're going to feel like they can breathe again. So in addition to the epinephrine to affect their blood pressure, a lot of times what they'll do in the lungs is they will give them a nebulizer of albuterol, beta 2 agonist, right? Stimulates beta 2 receptors to cause the bronchioles to dilate. Once you have maintained get their blood pressure back to normal and they're breathing okay, then you want to hit them with some antihistamines. And this is important. Antihistamines, all they do is prevent mast cells. Antihistamines prevent mast cells from releasing more histamine. Right? It prevents them from, stabilizes them so they can't release any more histamines. But they don't do anything for the histamines that were already released. So what did the histamines cause? It causes massive arterial vasodilation and increased capillary leakiness, right? So fluids leaking out of the cardiovascular system, and all of their arteries are dilated. So you have to constrict their arteries first to get their blood pressure back up. Then you give them IV fluids because they're losing fluid from the cardiovascular system because it's going out into the interstitial space. Or you can give them what's called salt pour albumin to draw the water back in by osmosis. but IV fluids at least initially. And then the antihistamines are given after you stabilize them to prevent the further release of histamines by mast cells. And then what they're usually done is they're told, don't get stung by a bee no more. You should write that down. And then they're usually given a course of steroids and prednisone. And what do steroids do? Steroids suppress the immune system. What's an anaphylactic reaction? It's an exaggerated immune response. It's an inappropriate immune response. It's an immune response that is reacting to something that it shouldn't react to. And the result is that they're given these steroids to suppress that. And remember that you give them a tapered dose of steroid. You step them down. And the reason you step them down is that we produce naturally occurring steroids, cortisol, from the adrenal cortex. So if you're taking high doses of steroids, say 40 milligrams twice a day for 2 weeks, and then you go off of it, the cells of the adrenal cortex in that time will atrophy, saying, well, gee whiz, I don't need to produce this stuff because I got a bunch of it in my blood. So those cells will atrophy. So when you go off of the high dose, those cells are still atrophied, so you'll get this rebound inflammation because you don't have any naturally occurring cortisol. That's why they step you down. That, ladies and gentlemen, is anaphylactic shock. I hope it helped. See ya.